Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
High blood pressure, also known as hypertension, is a serious medical condition that can bring on a cascade of negative health effects, including heart failure and stroke. It's often called a silent disease because many that have the condition don't even know it. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back. Joining me today is Dr. Sharon Hecker, a cardiologist and fellow of the American College of Cardiology. Dr. Hecker was featured on our Heart Hints and The Real Cost of Fast Food shows. Thank you for joining us again, Dr. Hecker.
Thank you, it's my pleasure.
It's great to have you here. So today we're going to be talking about hypertension. Can you tell us, what is it?
Yeah, hypertension is another word for high blood pressure. So it's when the pressure in the blood vessels of our body, predominantly the arteries, is higher than it ought to be.
So why is hypertension or high blood pressure called a silent killer?
Yeah, well, the increased pressure puts a lot of stress on our blood vessels. And the blood vessels, as you know, supply our whole bodies, our brain, our kidneys, our heart. So if those organs are under increased stress, it leads to a long-term wear and tear on the body.
So who's most likely to develop high blood pressure?
Well, there are a lot of risk factors for high blood pressure. Obesity is a risk factor. Sleep apnea, if you snore excessively, is a risk factor. But one of the really unfortunate things is as we age, all of us, our blood pressure slowly creeps up with each year that we live. Now, you would think this is a natural process, that our blood pressure rises as we age, but unfortunately we found that even though it is natural, it's not necessarily good for us. And intervening on this increase in blood pressure actually saves lives and prevents illness.
So what about the difference between men and women in hypertension?
Yeah, there's a little bit of a difference. Women tend to get heart disease a little bit later than men do. Additionally, women after menopause have a bit of an acceleration in their increase in blood pressure. But really, when you look at the whole population, it affects men and women equally and in just as severe ways, really.
So what about race or ethnicities? Are there differences there?
Yes, certain races are more likely to have high blood pressure and more likely to have ill effects from the high blood pressure. In fact, some races or genetic backgrounds don't do as well with certain of our traditional blood pressure medicines and need others. And an example would be African Americans. Mm-hmm. They have a tendency to develop high blood pressure at an earlier age and to require a little bit different treatment.
So how does someone know that they have it?
If you know that you have it, it's probably pretty severe. Usually the only way that you find out you have high blood pressure is when you go to the doctor's office or down to, say, Walgreens or Walmart and check your blood pressure and start to notice that it's on the high side. And by high side, I mean over 140 over 90. So any numbers either on the top or the bottom that are over that would be considered high blood pressure. Ideally, your blood pressure should be closer to 120 over 80.
So can you talk to us and the viewers about those blood pressure levels a little bit more? Help us understand that.
Okay, so the top number is the systolic blood pressure. That's the blood pressure that your blood vessels experience when your heart contracts. The bottom number is the diastolic blood pressure, and that's the blood pressure that your blood vessels experience when your heart is relaxing. The numbers are millimeters of mercury, so that's an atmospheric pressure that we gauge it against. And again, 120 over 80 is what's considered to be normal. It can be as high as 140/90 before we absolutely have to treat it, although certain disease states like diabetes warrant a lower blood pressure. And sometimes some patients, if they are very old or maybe have Parkinson's disease or some other problems, we might let the blood pressure run a little bit higher because the patients will feel better at the higher blood pressure.
So how often should a person take their blood pressure or have their blood pressure checked?
That's a really good question. If you have high blood pressure, you should have it checked more frequently, maybe once every week or two, to make sure that your blood pressure is within the range where your doctor would like to see it. For a person who's not yet been diagnosed with high blood pressure, probably just screening blood pressures when you go to the doctor or when you go again to maybe a health fair are reasonable. But once you start noticing that your blood pressure is on the high side, you might want to check it more frequently.
And then I'm assuming once you know you have high blood pressure, then you need to start thinking about different ways of controlling it. And I'm assuming I hear about salt in a diet. So can you talk to us maybe just about salt?
Yeah, that's correct. Decreasing the salt in your diet to, again, less than about 2,000 milligrams per day can have an impact on your blood pressure. I also like to tell people that there is a diet called the DASH diet, which is the dietary approach to stop hypertension. It's basically a low salt diet, but it's also high in calcium and potassium, high in fruits and vegetables, low in simple carbohydrates, and that by itself can help to lower the blood pressure as well as one of our medications. Another thing I would like to add is that just losing 5 to 10 pounds, just by losing the weight, will lower your blood pressure. So if you're frustrated, and you're like, I don't want to start this medicine, just losing a little bit of weight would really help.
Good information. Thank you. So we're going to pause now and take a quick break. Stay tuned to learn what types of conditions and negative health outcomes high blood pressure can cause. We'll be right back. Welcome back. We are continuing our discussion on high blood pressure with Dr. Sharon Hecker. Nice to have you back with us. So hypertension can cause serious damage to our bodies. Let's talk about the arteries and what unchecked high blood pressure can do to them.
Well, first I'm just going to describe a little bit about what kinds of things unchecked high blood pressure can lead to, and then I'm going to explain a little bit about why. Okay. First of all, unchecked high blood pressure causes all kinds of problems. It can lead to strokes, it can lead to dementia, it can lead to heart attacks, as well as congestive heart failure without having heart attacks. It can lead to atrial fibrillation, peripheral vascular disease, erectile dysfunction, and kidney disease. So there's all kinds of things that it does. And why does it do this? You think, okay, well, how bad really could it be? I feel good, I feel fine. The problem is the high blood pressure is kind of like spring runoff in Montana. If our arteries are the rivers, and all of a sudden we have all this flow down the rivers, and those are our arteries, you can imagine debris gets distributed here and there. Banks erode. In fact, the erosion is actually a problem within your blood vessels. If the blood vessel is, or if the blood pressure is too high for too long, you can actually have ballooning of your arteries, and aneurysms can form, and those can rupture and kill you. So we just don't want that uncontrolled flow of blood to go throughout the body. It needs to be restrained the way the rivers look maybe in July or August instead of May or June.
So I can imagine the heart is impacted by all this. So can you talk about the damage specifically to our hearts?
Right, yes, I can. What happens when the heart has to pump against such a high pressure is that it gets thick. It gets muscle bound, just like a bodybuilder would get, like Arnold Schwarzenegger. And when the heart gets muscle bound like that, the blood tends to back up into the lungs, and we call that congestive heart failure. Lowering the blood pressure can actually cause regression of the stiff heart muscle and help the heart to behave more normally. Additionally, the blood vessels that supply blood to the heart, those also can be damaged by the effects of high blood pressure. Again, forming blockages or aneurysms, and lowering the blood pressure will then help the body to heal itself.
So what about our brains and hypertension?
Yeah, the very same thing. This high pressure head going to our brain actually makes us feel good. So people lots of times don't like to take the blood pressure medicine because having high blood pressure will make your brain feel energetic and happy. And when we give you medicine to lower the blood pressure, you might feel tired or sleepy for a while as your brain adjusts. Unfortunately, if we let the pressure stay high for a long period of time, you'll start having problems. Again, strokes are a big problem. One thing that is very insidious that people don't realize, I think, is that you can have small, almost microscopic strokes over long periods of time that end up leading to dementia.
And so would we not know that these little strokes, small strokes, are happening?
You might not know until you're fully demented.
Oh my goodness. So what about things that are external, like cigarette smoking? Can you talk to us about that?
Yeah, cigarette smoking is interesting. It doesn't exactly increase your blood pressure by itself, but what it does do is the effects of cigarette smoking are additive to the high blood pressure. So it's an extra stress on your already fragile arteries if you have high blood pressure.
So what about other impacts of hypertension? Can you talk about some of those that we might not even think about? Like fainting, could you faint? Could you talk about some of those issues?
Yeah, sometimes your blood pressure can get so high and become so uncontrolled that you can actually suffer from what's called cerebral edema. That is, your brain swells in response to the blood pressure. That's an extreme circumstance, and we don't see it very often, but it can happen. And that might show up as blurred vision, headaches, or even loss of consciousness.
So if someone has high blood pressure, they should be monitoring their blood pressure frequently. So what about home monitoring units?
Home monitoring units are great, but I will give a few caveats to that. The first one is that all blood pressure monitoring systems, with the exception of the mercury manometers, tend to drift with time. And so some of the brands, and you can't even tell based on the expense, a cheap blood pressure monitor might be just as good as an expensive one. But they do tend to drift. And so we recommend that a person get their blood pressure monitor at home checked against an office monitor quarterly. So every 3 to 4 months you should have it checked to make sure that the readings are similar. Additionally, I would also caution people against rechecking their blood pressure frequently. We know that if you recheck your blood pressure, each time you check it, it will go up in a short period of time. So if every 5 minutes you're checking your blood pressure, it'll go up, and it'll go up, and it'll go up. And you can actually cause yourself to have a problem. So if you're gonna check it at home, just check it maybe once in the morning and once in the evening, or even just 2 or 3 times a week.
And then go to your physician, or when you go to your physician, take that monitoring device with you so it can be checked there.
Exactly.
That's great. Okay. I had no idea that high blood pressure could cause so many issues. Stay tuned to learn what you can do to control hypertension if you have it. We'll be right back. Welcome back. We're here with Dr. Sharon Hecker discussing high blood pressure. So far, we've learned what hypertension is and the negative health consequences it can have if not controlled. Let's now talk about what people can do to control it and some other important items related to high blood pressure. Thanks for continuing to be here with us. So let's talk about who has high blood pressure. Talk about the demographics.
Well, high blood pressure is very common in our society. Statistically, 1 in 3 Americans will suffer from high blood pressure in their lifetime, and that comes out to almost 75 million people. Blood pressure can affect folks at any age. Even young people can develop high blood pressure, and 95% of our high blood pressure is what's called essential hypertension, meaning that we're not sure why people have it. Their blood pressure just starts to go up and needs to be treated. There are a few secondary causes. That's the 5%, maybe due to a congenital kidney problem or something like that, but it's much less common than just plain old high blood pressure.
So what about lifestyle changes that we can take or make to help control high blood pressure?
Well, lifestyle turns out to be very potent. Just by losing a little bit of weight, no matter what your weight is, will help to lower your blood pressure. Exercise, regular exercise, also helps lower the blood pressure. Paying attention to your stress level, so spending time doing relaxation, maybe yoga or meditation, that helps dilate our blood vessels and lower blood pressure. And then lastly, eating a diet that's rich in fruits and vegetables, high in calcium and potassium, and low in sodium or salt also helps to lower the blood pressure.
So how about talking more about exercise? So I'm assuming it's not just running marathons or doing, lots of aggressive exercise. There's some simple.
Oh, yeah, that's a good point. It could be any type of exercise. It could be going for a walk. It could be just going to the gym and doing some weightlifting or aerobics classes. It could be a yoga class. It could be swimming, bicycling, playing with your kids, gardening.
So stress, you mentioned stress, and you mentioned it as it relates to high blood pressure. Can you talk more about that? We all feel stressed, living is stressful. Talk more about stress.
Yeah, our bodies respond to stress by raising our blood pressure, raising our heart rate, getting us in that mode of fight or flight. And if we can find ways to relax, that will bring our blood pressure down. A really unfortunate sort of side effect of modern culture is that we are stressed a lot of the time. It's appropriate to be stressed if you're running, say, from a mountain lion. But if you're always stressed, if you're always feeling like it's life or death, life or death, life or death, your blood vessels constrict and your blood pressure goes up.
So I've heard about something called white coat hypertension. Can you talk about that? What is it?
Yeah, white coat hypertension refers to the syndrome of when a person goes in to have their blood pressure checked at the doctor's office, either with a nurse or a doctor who's wearing a white coat, their blood pressure will go up. That increase in blood pressure might be transient, so it might just occur for the 5 or 10 minutes that they're there in the doctor's office having their blood pressure taken. Or it might be a sign that every time they're stressed, whether they're in traffic or their rent check is late or maybe one of their kids gets in trouble at school, every time something like that happens, their blood pressure goes up. So we tend to look at quote unquote white coat hypertension as a flag that maybe a person has high blood pressure the rest of the time as well. For those people, checking your blood pressure at home is really valuable, and then bringing in a list of those blood pressures to your doctor along with your home blood pressure cuff can tell us if you really do have white coat hypertension or not. Another couple of things I'd like to say about that is that most of our trials where we look at patients' blood pressure and whether or not lowering it is beneficial use a office blood pressure. So it's the blood pressure that's taken by someone with a white coat. So we know that even if your blood pressure only goes up in the office, it might still be beneficial to treat it. So that's one point that I'd like to make. The other thing I'd like to say is that if you're really convinced that your blood pressure is only high at the doctor's office is never high at any other time, or you think maybe it gets too low even at other times, we have ambulatory blood pressure monitors. So we can actually monitor your blood pressure at home for a 24-hour period and find out how often your blood pressure is actually elevated.
Wow. So what about alcohol and high blood pressure? Can you talk to us about that?
Yeah. Alcohol does raise your blood pressure, not right away, but after you've had a couple of drinks, a few hours later your blood pressure will start to go up. One of the ways you can lower your blood pressure is by cutting back on your alcohol intake.
Okay. So other recommendations you might make for our readers who are either concerned that they might have high blood pressure or they know they have it?
Well, I think the first thing you need to do is be aware. So know what your blood pressure is, know what it tends to run, where you're at, and then how you feel. I'd also recommend taking an assessment of your lifestyle. Do you eat healthy foods? Are you overly stressed? Are you getting enough exercise? Maintaining your ideal body weight? All of those things are really important, not only to prevent high blood pressure, but also to treat it. Then the next thing I would really stress is that you need to have a good relationship with your primary care provider. And that should be someone, a nurse practitioner, a physician's assistant, a physician, that you have a good relationship with. The reason for that is there are many, many blood pressure medications. And if the first few that you try, like if you try one and it really makes you feel sick, or you try another and it doesn't make you feel good or it gives you a rash, we can just keep trying medicines until we find one that works.
Oh, great information. Thank you, Dr. Hecker, for all that you have told us. I really appreciate your time today, and I want to thank our viewers at home for tuning in. Until next week, stay fit, stay well, and stay healthy with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.